So, Shane, we hear a lot about anxiety. Would you say many people suffer with anxiety?
Yeah, I'm afraid they do. Many people suffer with anxiety. But the anxiety varies with each person. I mean, it's pretty natural to feel anxious when you're facing a testing situation, such as taking a driving test or doing an exam or something like that. But a lot of people, they have a persistent fear that becomes overwhelming and it interferes with their daily life.
And would you say there are lots of different types of anxiety?
Yes, it's sort of a form of interpretation. There are lots of different types, and because everyone is different, they react slightly different. I mean, some people have a severe shock type of anxiety reaction after a big blow, like a death or a family crisis, and some people might say that's normal, if such a thing exists. That's normality. And then exaggerated worry about the future is common. People are always worrying about what's going to happen, rather than being in the moment. Catastrophizing or blowing things out of proportion is a frequent issue for anxious people. And sometimes people get a delayed shock type of anxiety. They get on with it. Something happens, they get on with it, they man up and get on with it, and then it hits them later on. Sort of panic attacks in the middle of the night are a good example. They've sort of dealt with it, and then in the middle of the night it comes back to visit them.
And what about post-traumatic stress disorder? Is that anxiety?
Well, PTSD usually follows a harrowing experience, and it can cause anxiety. But it's a good point you've brought up. It's not just massive experiences that can bring on anxiety. Small things can make some people anxious. It's to do with our environment and upbringing, and small things can trigger feelings of unease. And then there's social anxiety. I mean, many people become very anxious when they are with people. They're not sure how to interact, and they go into a sort of a close down. I mean, some might really dread this and become embarrassed or afraid, or just avoid people altogether. You see, frequently what seems to be fine to one person can give another person a heap of anxiety, and they have a panic attack. And physically as well, you can be affected physically. Physically, people can have a shortness of breath, numbness, they can feel faint, they can shake, they can even have chest pains.
It sounds horrible. Do some people feel anxious all the time?
Yeah, it is horrible, and many people have a permanent anxiety and feel anxious on most days. And these symptoms, they can increase and decrease in relation to stress at home or stress at work or stress meeting people. But often there seems very little rational reason for the feeling of panic. So, in conclusion, anxiety is common. It can be kind of illogical, and it is unique to each individual. But if we discover why that specific person worries so much about a specific thing, we can ease that anxiety.